the recording on, not now. So 1 minute. Hello, very good evening everyone. So welcome you all to the platform of learning. So Cognize, always we try to learn, unlearn, and new things we need to learn. So all the students or all the nutritionists, all the dietitians who have joined, thank you all of you for joining. So today it will be a very interactive session. We will try to learn from our own students that what are the new things and many things which are very common, that also we will discuss. So the World Hypertension Day is globally celebrated each year on the May 17th. And in this year 2022, the theme is Know Your Number. So it is very important theme given by this organization, that is Know Your Number, means in your age. Now I can see more than 50 people, 40, 45 people have joined. How many of you periodically check your blood pressure? Just if the answer is yes, the answer will be less than 10-15%. So that is the thing, we as a healthcare provider do not bother about our own health. So how we will create the awareness in the society? And there should not be any particular day. Obviously, like Mother's Day, we maintain a day for a Mother's Day, but Mother's Day is every day, 365 days in a year. Father's Day is 365 days in a year. Same as this Hypertension Day or Diabetes Day should be, the awareness should be 365 days. Every day your task is to aware people, make people conscious, to remove the myths, to make them aware about the facts. So these are our like responsibility as a nutritionist or dietitian. So I would like to request, okay, I am sharing the screen, no issues. Then I will introduce you one by one. So I will like to request you all to switch on your videos. So is the screen being shared?
Yes,
Yes,
sir.
sir.
Okay, the recording is on.
Yes, sir.
Okay, so let's start without any delay. So we have with us dietitian Suparna. Dietitian Suparna is masters in dietetics and community nutrition from Vidyasagar University, and she has worked in ILS Park Clinic as a trainee dietitian. After that, she worked in VLCC. Now she is with a multinational nutrition company as a nutrition advisor and working with many renowned gynecologists and diabetologists, endocrinologists of Kolkata. Next, we have Swati Pandey. Swati Pandey is also completed her master's, and after completing her master's in dietetics and food service management, she did her internship in KPC Medical College. After that, she worked in Sanjeevan Hospital, and she is now working as an online dietitian consultant with an international organization. Along with, she is also the consultant dietitian at PIF Fitness, that is a fitness center or gym. And then we have our dietitian Mafuza Akhtar Munni. She is the dietitian from Rangpur, Bangladesh. She is working as a nutrition consultant at Nabik Korim Hat Hospital. If I am not wrong, Mafuza, the name of the hospital. She is a dietitian there. Riya is also doing her master's, along with she is also doing her internship from a multi-speciality hospital. And we have Fatma Firdos with us. Fatma is also working as a consultant dietitian in VLCC, and she is completed her graduation from Gokhale Memorial. We have Ms.Pritha Bose, who is also graduate from Gokhale, and now she is about to complete her master. She did her internship from Ranchi, and she also belongs from Ranchi. So without any delay, we will discuss, and I would like to invite Pritha Bose for this session. Pritha will move on with the introduction part. Then the cause and the symptoms will be discussed by Fatma Firdos, the complications and the medication part. That is very important to know what are the medications of hypertension will be discussed by Suparna Mondol. The dietary management, this is a very important part for a dietitians. So the current aspects will be discussed by Mafuza. The management, the very interesting part Swati will discuss, that is nutrition labeling. So these things will be discussed by Swati along with yoga and meditations and exercise. And myths and facts, that is very interesting. People think whatever they think might be, the patients are always wrong. So these things will be discussed by Riya. So give me just a minute. I have to join from one more device, otherwise I will not be able to share. Yes, just give me a second. Pritha, first you will start, right? You are on mute.
Yes, sir, I will start the introduction.
Okay.
So, a very good evening, everyone. I am Pritha Bose, as sir has introduced. So, I will start with the introduction part of the disease called hypertension. So, we very well know that before only some days ago, the World Hypertension Day was celebrated on 17th of May. So, in honor of that day, we are presenting this presentation on hypertension to you. So, what is hypertension and why is it neglected? What are the causes? What are the risk factors? We all will discuss about these things, and I hope this presentation will be fruitful to you and you gather and take a lot of knowledge with you. So, next slide, please. I would like to start with this quote, which is written by Stella Payton, and it says that people take ownership of sickness and disease by saying things like my blood pressure, my diabetes, my disease, my depression, my. Don't own it because it doesn't belongs to you. So nowadays we see that people flex about their diseases. Like one person A will say that, I have been diagnosed with sugar. Then person B would say that the sugar that you are saying, no, it is called diabetes actually, and I have got it since 5 years ago. And along with that, I have got hypertension also. So people are like comparing themselves. It's like a trophy or something. But and saying that my disease, my condition, my medications, and all these things. So when you uh, give this kind of energy to a disease or to any negative thing, it will obviously become yours. But instead, if you consider it to be a disease or an ailment which does not belongs to you, it will be very easy to remove, because when something belongs to you, it is very difficult to remove. But when you think that it is something that does not belongs to me, I don't own that thing, that means it is very easy to remove. The one thing that you own is your health, and you should be focused on that. So keeping this thing in mind, we will proceed. Next slide, please. So the main organ that concerns this disease is the heart. We all know that the heart is the main pumping organ in our body, which has 4 chambers: the right atrium, the right ventricle, the left atrium, and the left ventricle. From the right atrium, the blood flows to the left ventricle, and from there it goes to the lungs for oxygenation and deoxygenation. And then it returns to the left atrium, goes to the left ventricle, and from left ventricle, the blood gets transferred to the entire body. Now, the thing that concerns the disease is the pumping of the chambers. पंप करेंगे तो ही रिलैक्स होंगे, तो ही ब्लड फ्लो मेंटेन रहेगा. रिलैक्स होंगे, कॉन्ट्रैक्ट करेंगे, और वो चीज मेंटेन होगा हार्ट चेंबर्स के पंपिंग से ही. सो नेक्स्ट स्लाइड प्लीज. So the main disease is hypertension. Okay. So what is hypertension? Hypertension, look, people say that hypertension is like elevated blood pressure. Bas baat khatam. Bath is not khatam. Bath is just getting started over there, the elevated blood pressure. So to go by the conventional definition of hypertension, hypertension is a condition when the pressure of the blood on the walls of the arteries exceeds the normal pressure. Just like a pipe of water, okay? The water is flowing through the pipe and it has some certain, it's exerting some certain pressure on the walls of the pipe. इसीलिए जब कहीं पे कोई crease आ जाता है, तो the pipe gets a leakage or the pipe bursts, there is an outflow of the water from the pipe. The same thing is happening with our arteries. The blood is applying a certain kind of pressure on the artery walls, but when that certain amount of pressure exceeds, there is hypertension. Okay. Now here I have given two pictures, the normal heart and the hypertensive heart. In the hypertensive heart, there is the thickening of the ventricles. This is one of the reasons of hypertension, where the walls of the heart thicken. And the another reasons are, there are many another reasons which we will discuss later. Next slide, please. Coming to the prevalence. 1.28 billion adults between the age of 40 and 70 have hypertension, and that is a very, very, very alarming number. In young age like us, in the age gap, period between 20 to 30, we think that hypertension is the disease of the elders. Why should we be bothered about it? How does it concern us? But the thing is, anytime if we go and check our blood pressure in the college camps or in the medical camps of our office places or in our workplaces or the regular blood donation camps, if we go there and just check our blood pressures over there, we will see that half of the people have the elevated blood pressure and it goes undiagnosed because in the initial stage it is asymptomatic. Many of the people are getting heart attacks suddenly and they think that achanak se ho gaya. These things do not happen achanak se. These things give a very ample number of warnings before attacking your health, before attacking your life. So this is, hypertension is a very prevalent disease with a very low awareness rate, and estimated 46% of the adult who have hypertension, they are not even aware of it that they have hypertension. And these data are collected from WHO website, so they are the actual numbers. This is the actual scenario that is going on. Next slide, please. So there are very huge number of factors that affect the blood pressure, but these are some of them, and we have been studying these factors from the very beginning of our BSc. So the very main thing that affects the blood pressure is cardiac output. Now, what is cardiac output? Cardiac output is the product of heart rate and stroke volume. What is heart rate? Heart rate is the heartbeat, beats per minute, and stroke volume is the amount of blood ejected from the ventricles per cycle. Now, blood pressure depends on this cardiac output and systemic vascular resistance. What is systemic vascular resistance? It is the resistance by the blood vessels. Okay. And another things that are age, with increasing age, the arteries get hardened. So there is vascular resistance because of the stiffening of the arteries. Then there is the predominance of the male gender. They tend to get this disease, hypertension, more frequently than females. And after menopause, the chances are equal. Then there are emotions like anger and palpitations happen because some people who are very emotional get a shock or react very much. They tend to get hypertension. Then climate, meals. Sometimes we eat a very heavy meal, and after taking a meal, the blood, the heart pumping of the heart increases. So if a person with weak heart goes for a meal which is too much for his body's capacity, then that is a danger factor for him. Next slide, please. Okay, very important slide. There are two types of blood pressure. Okay, systolic pressure and diastolic pressure. Systolic pressure occurs when the heart chambers contract, and diastolic pressure occurs when the heart chambers relax. So when the diastolic pressure is happening, the blood pressure is falling on the chamber walls, and when the systolic pressure is happening, the blood pressure is occurring on the artery walls. Next slide, please. Here I have shown a graph in which we can see the pressure of the blood on the different blood vessels and pressure of the arteries on different blood vessels. So we can see, to start with, we can see that in aorta, that is the artery that supplies blood to our entire body, which is a very thick one. So aorta may the blood pressure is very high, the highest if we can say, and in vena cava the pressure is the lowest. Similarly, the vascular pressure is the lowest in aorta and highest in vena cava. Next slide, please. This is the traditional hypertension range table that we always follow. This is taken from American Heart Association. Okay. No, there is the normal range, which is 120 by 80 mm of mg. We all know. Then there is pre-hypertension 120 to 139 or 80 to 89. Now, the thing that you have to see here is that both of the levels will be present in your report. Then only you will have hypertension. That is not true. दोनों में से कोई एक भी होगा तो you are in that danger phase, because here is written or, and सिर्फ first वाले में लिखा है because दोनों रहने से वो ideal होता है, and the rest of these में और लिखा है because दोनों में से कोई भी एक होगा तो you are in the danger zone. But in the later age, like 40, 50, in that age, the upper pressure can be up to 150. Okay, in later age the upper pressure can be up to 150, but in people like us, the youngsters, the lower level has to be below 90 mm of Hg. If it exceeds that level, we are in danger. We should take serious step if the level is coming above 90 in our age. Okay, so next slide, please. Here I have given the similar slide just to show that how the danger is increasing with the increasing numbers. Okay, then first there is the normal blood pressure, then there is elevated blood pressure. Elevated blood pressure means there is a high chance of getting it reversed. Then there is high blood pressure, which is also known as stage 1, and then there is high blood pressure which is also known as stage 2. There is slight difference between these two things, and the last stage is known as hypertensive crisis, जिसमें immediate medical attention is needed. Next slide, please. So why do you think that knowing about hypertension is so important? Just in the beginning, as I said, that hypertension is not the end, it is just the starting, which means that it can lead to several other diseases which can damage your body in various issues, in various aspects. So the first one is the very well-known heart attack or myocardial infarction. We all know that hypertension, if not treated, leads to MI. Then there is neurological damage. If the hypertensive blockage or something of that sort is happening in the arteries which supply blood to the brain or the neck, the carotid artery, then there is the very high chance of happening stroke or dementia, the forgetfulness. Then there is retinopathy, the disease related to eyes, headache, blood vessel damage, obviously, and then renal failure. If that problem occurs in the renal arteries, then there can be renal failure, CKD. We will discuss about this later. Okay, next slide, please. So why do you think that hypertension is neglected? Stroke, cardiovascular events, peripheral vascular diseases, all these are very prevalent in developing ages, in especially when adults move towards the old age phase, right? One question is to be asked is, do you check your blood pressures regularly? Like, and the answer would be no in most of the cases, because we think that why should we, how can we get hypertension in such an early age? But as I said, it can occur in any time, in any case. But if it is detected early, then the treatment can be fruitful. But if you are delaying it, then several number of complications may prevail, which can be untreatable and can be resulted as fatal, right? People in their normal conversation use that, you are annoying me, my blood pressure will rise. They think that rising blood pressure or an elevation in the blood pressure is such a normal thing. We jokingly use these terminologies, but actually when you sit and think about it, blood is in our entire body, and if that blood pressure increase, can you understand what kind of harm it may cause to our body? The awareness is very low regarding this disease because people don't know half of the things related to it, but the prevalence is double than the low rate of awareness. So we need to spread awareness regarding this disease to let people know that what kind of a dangerous monster this disease is. Next slide, please. Okay, so I would hand over the presentation to Fatma. She will talk about the causes and symptoms. Thank you so much.
Hope I'm audible and visible.
You are visible from
No,
one
you are not visible.
device. According now,
You were just visible, but then now.
acha, no issue, no issue. You continue with that.
Okay. So, good evening, everyone.
And
Thank you
switch on
for
your
this.
video from the other device. No issue.
Hello. Yes, sir.
Switch on your video and audio from the same device if it is possible.
Okay. Just a minute.
Pritha, keep the discussion on. Okay, so we should not get it delayed. So we will post the question at the end. You can post your question now. We will answer your questions at the end. Because what?
Now,
Yes,
now
yes,
it's okay.
yes, it is okay.
Okay, sorry for the interruptions. Good evening, everyone. First, I would like to thank Cognize Nutrition for arranging this wonderful awareness program, and I'm glad to be part of this. And also thanks to Ms.Pritha for explaining so nicely about the hypertension. She has done half of my work already, and thank you very much. Myself, Ms.Fatma, and from Kolkata, West Bengal. I completed my graduation last year, 2021, from Gokel Memorial Girls College in clinical nutrition and dietetics. So let's begin. Today I will discuss about the causes of hypertension. We all know if there is any disease, there must be some cause as well, symptoms also, and maybe complication as well. But you will shock to know that the exact cause of hypertension is still unknown. But there are several factors as well that may increase the risk for high blood pressure. So it can be risk factors can be further classified into two, that is modifiable risk factors and non-modifiable risk factors. First, I would like to describe modifiable risk factors. Modifiable means what? Which can be modified, which is in our hand. Okay, so we can change, we can modify it with our own effort. First thing is overweight or obesity. Overweight or obesity can say like is the main root of every disease, each and every, like hypertension, cardiac, diabetes, thyroid, every problem one solution. If you lose your weight, if you start paying attention in your diet and physical activity as well, 50% each, 50% diet, 50% exercise. Next is too much salt consumption. I have seen many people, maybe among us also, there are some people who like to add extra salt to their meal, having their lunch or dinner. They like to add salt in their meal and then eat. I don't know why, but there may be the lack of knowledge that they don't know because of extra salt they are adding. There is water retention also, and there is sodium percentage increasing in their body, which may lead to hypertension. The very major factor of excessive salt consumption. Next one is potassium intake. Many people don't like vegetable or don't eat fruits on daily basis, but we don't know that potassium is rich in all vegetables, and all fruits are so rich in potassium, and it is very important. Saturated fats. So saturated fat is like a can say the other major factor for the hypertension as well as cardiac. Because saturated fat is rich in LDL, and LDL is not good for health. Okay, so saturated fats like, for example, whipped creams, fatty meats, processed meat, all these contents lost lots of saturated fat. But what I say is saturated fat, PUFA, MUFA, all should be consumed, but in moderate amount. Next one is too much alcohol consumption. Okay, so more than one or two, in fact, 2 or 3 drinks per day can lead to alcohol consumption. Anyway, alcohol is not a good option or not a good thing for our health. It may lead to many diseases like liver problem, kidney problem, and many others. Another one I want to discuss about the smoking. Smoking is like a tradition in nowadays. Many girls, many youngsters are smoking, and what happens is it constricts blood vessel. It decreases oxygen to our heart and increase our heart rate. It may increase blood clot as well. Basically, smoking damages our blood vessel and cause inflammation, which lead to plaque formation. What is plaque? We will discuss in our upcoming slide. So, the plaque causes heart attacks and strokes, and additionally, smoking can harden the arteries and raises blood pressure in a long run. Next one is socioeconomic status. Socioeconomic status, like now the many people are so worried about their socioeconomic status. People, youngsters as well, are so much stressed for their so career in oriented job. All this will may lead to hypertension, not constricted to elderly people. As Ms.Pritha already said, it can occur in any age group. Okay, and the next one is sleep apnea. Sleep apnea is like an atom bomb, you can say, because sleep apnea, many if you all remember that many celebrities like Bapi Lahiri died because of sleep apnea. So sleep apnea may also be modified if by medication and lifestyle management. Excessive caffeine intake. So now I will discuss about the non-modifiable risk factors. As you can see, compared to modifiable risk factors, there's not so much non-modifiable. Non-modifiable means which is not in our hand, which cannot be modified by by us, like age, gender, genetics, race or ethnicity, chronic kidney disease, adrenal or thyroid disorders. If these are if these are there, it cannot be modified. But because of this, we cannot forget about the modifiable risk factors. We can overcome these non-modifiable risk factors. So next slide, please. Hmm. Here I have included this slide because it's a very important slide for me and many of us, because many people don't even know the difference between the symptoms of low blood pressure and high blood pressure. Many people because of lack of knowledge, what are the symptoms. Like suppose a person in front of you have some symptoms like dizziness or the difficulty in breathing, irregular heartbeat, but you don't know whether it's high blood pressure or low blood pressure. What you will do, घरेलू नुस्खा, होम रेमेडी, आप वाटर में पानी में नमक डाल के दे दोगे. It may worsen the condition of the patient, right? So blood pressure symptoms should be known by all of us, like low blood pressure symptoms, which is called hypertension as well. A person may feel dizziness, lightheaded, fatigue, blurred vision, dehydration, like unusual thirst, fatigue, rapid shallow breathing. So this come all under low blood pressure symptoms, which are very common. And the high blood pressure is difficulty in breathing, chest pain. Chest pain is not specifically chest pain, but it may pain in neck also, in your right hand, left hand, anywhere can be pain occur because of high blood pressure. Irregular heartbeat, blood in urine, vision problem, fatigue or confusion. So all these are the symptoms of low blood pressure and high blood pressure. So we have to remember one thing I would like to add here, that so those diabetic patients may keep their acute check in their home for regular checkups, or periodically checking their blood sugar level. So why not keep a sphygmomanometer, which is a device used for blood pressure? Why not we keep a sphygmomanometer in our home? Okay, don't know how to use. So nowadays so convenience for us that there is availability of a digital sphygmomanometer. One can cuff the belt in a patient's hand and measure the blood pressure so easily. Next slide, please. Okay. I've already discussed most of the symptoms and signs, so I will not discuss more here, but I would like to mention one word, that is silent killer. Hypertension is referred to as a silent killer because it does not produce any symptoms. Even if you had it for years of hypertension, it may not show any symptoms. That's why it's called a silent killer. That's why we constantly focusing or wearing all of us to have a regular blood check, not regularly. ऐसा नहीं कि आपको हर दिन blood pressure ही check करना. It also will cause harm to your body. At least monthly or weekly, if I can hypertension patient twice in a week, sorry, 2 week 2 हफ्ते में एक बार आप कर लो, या महीने में एक बार करो, या जब आप डॉक्टर के पास विजिट करने जा रहे हो तब आप करवाओ ख्याल से. लाइक वहाँ पे बहुत सारे हेल्पर होते हैं डॉक्टर्स के जो चेक करते हैं, तो आप ख्याल से अपना blood pressure check करवाइए. So I have already mentioned the given symptoms written here. Next slide, please. Okay, so I would like to highlight some of the complications of high blood pressure. Okay, so artery damage. As we all are hearing from the beginning that blood pressure is something pressure increases in the arterial wall. So arterial wall is not in a specific position in our body. It throughout our body, every part is there arterial wall, blood flowing through it, right? So if there is any damage, any clot, any problem in our artery, it may affect any part of the body. So artery damages, our artery should be like sturdy, springy and smooth to move blood easily from our heart and lungs to our organs to other tissues. But in case of high blood pressure, what happens? It pushes too hard on our artery walls, which may damage the inside and causes fat or plaque which is flowing through it to collect. And this plaque makes arteries more stiff and narrow, so they can't do this job as well. Aneurysm. Many of us may have never heard this term aneurysm, but I would like to highlight this. Like aneurysm is like when pressure pushes out of a section of an artery wall, it weakens it. If it breaks the artery, it can bleed into our body, and it could create a serious problem. So it is possible if in any artery, it can be happen with any part of the body in any artery, but an aneurysm is most common in aorta, which most moves down the middle of our body. And if a person having damage may have damaged artery, or one could get aneurysm even if they don't have high blood pressure. Okay, so coronary arteries. So you can see here, so many of the complications related to hypertension is related to heart only, like artery damage, coronary artery disease, heart attack, stroke, enlarged heart failure. All are mostly related to heart only. That's it. I would like to call Pritha Bose to further highlight the complications of hypertension and explain about it. Thank you so much.
Thank you so much, Fatima, for explaining wonderfully about the causes and the symptoms. We will begin with the complications. So I would like to start with the CKD and the link between the CKD and the hypertension. So as we all know, the kidney and elevated blood pressure and cardiovascular diseases. We can say that these three things are interrelated, and there is an ongoing vicious cycle between these three things. So uncontrolled high blood pressure will lead to stiffening and hardening of the renal arteries. Okay, and that will lead to low blood flow or slow or rather no blood flow to the kidneys, which will lead to impairment of functioning of the kidneys, and which will result in the kidney damage. And we all know that when there is kidney damage, there will be retention of fluid, increase in plasma volume, there will be toxication of the blood, which harms our body in many ways. So in this picture, we can see that elevated blood pressure leads to cardiovascular disease, and also elevated blood pressure leads to kidney diseases, which ultimately leads to cardiovascular diseases. So this is just like a vicious cycle between, we have studied in community nutrition, right? The malnutrition, immunization, and the infection. So these three things are also moving in a cycle just like that. Next slide, please. Now, particularly in CKD, what happens? There is this calcitriol. Okay. Sorry, my video switched off. So in CKD, what happens? There is this calcitriol component which is released from our kidneys. So calcitriol is the active form of vitamin D. Okay. So when this calcitriol helps in absorption of calcium and phosphorus from the blood. So when there is calcium, when the kidneys are damaged in CKD, what happens? The kidneys gets damaged. So when kidneys gets damaged, the calcitriol production decreases, and when the calcitriol production decreases, the calcium and phosphorus absorption also decreases, and when the absorption decreases, the phosphate and calcium concentration in the blood increases, which is very harmful. I would like you to pay very much attention in what I am saying right now. So more phosphate in blood, what happens in that scenario? The phosphate binds to the normal cells in our body, the healthy cells. Okay. After binding to the healthy cells, it initiates the calcium binding with that cell. तो एक बार फॉस्फेट उस सेल के साथ बाइंड कर जाने के बाद कैल्शियम उस सेल के साथ बाइंड करने लगते हैं. दिस प्रोसेस इज नोन एज कैल्सिफिकेशन of normal cell, normal healthy cells. So when phosphate binds to any cell, it calcifies it by attaching more and more calcium with that cell. So when calcification of normal cell happens, there is cell death eventually. How this cell death occurs? When we know that the cell has different organelles like the cytoplasm, mitochondria, nucleus. So when the cytoplasm is oversaturated with calcium, these calcium moves, there is an excessive calcium inflow in the mitochondria, and the excessive calcium inflow in the mitochondria leads to impaired normal metabolism in the mitochondria, which eventually leads to cell death. And we know that the cell makes tissues make organs, and when there is cell death, eventually it affects the organ, and the organ also declines. The function of the organ is also declined. So I hope this is very much clear. Next, I would like to call upon Ms. Suparna Mondal for explaining the pregnancy-induced hypertension, which is also a very important complication of hypertension. Thank you.
This area will be going to be very interesting. What Pritha has discussed and what Suparna is going to be discussed, with what Suparna will discuss now. So that is pregnancy-induced hypertension. Suparna, you can start your discussion.
Yes, sir. Am I audible, sir?
Yes.
So thank you, Pritha, for explaining CKD so well. Good evening, everyone. I am dietitian Suparna. So our fellow speakers has described so far prevalence, causes, effects of hypertension very well. This is really alarming that nowadays very young adults are hypertensive and still they are unaware of the situation. There are many damages hypertension causes in our body, which we have already seen. One of them is pregnancy-induced hypertension or gestational hypertension. This means that the lady was not hypertensive before, but she develops hypertension after getting pregnant, and mostly it develops after 20th week of conception. So this is a very threatening condition, and if it is left unaddressed and not maintained promptly, it may lead to a situation which is known as preeclampsia. And this situation could be fatal for both mother and the fetus. The signs and symptoms, or maybe you can say the complications of preeclampsia includes the swelling of the face, hands, the pedal edema, abdominal cramps, sudden weight gain due to the fluid accumulation and blood volume increase. Also, it increases the high blood pressure, and then again the situation get worse. And if left untreated, it may affect the kidney and cause protein excretion in the urine. And at the severe stage, it can cause muscle twitching and seizures. And if still left untreated or undiagnosed, then it can lead to coma also, and death can also occur. But if the mother and the baby survives the delivery, but they didn't maintain the hypertension well throughout the pregnancy, this may lead to the mother might become hypertensive for lifetime, and the risk of the baby developing hypertension in later life increases many folds. Next slide, please. So here we see the mechanism that salt intake increases our body's sodium concentration in our blood. This causes retention of water in our kidney and through our kidney, and it increases the blood volume, which pushes the water, excess water, in the extracellular fluid, extracellular space. So extracellular space and blood volume both increases. This means the mean circulatory filling pressure is also increasing, which in return causes the venous return of the blood to the heart increases. So when the heart receives more blood, it will have to pump out more blood. That increases the cardio output and then increases the peripheral resistance, and it will further increase the arterial pressure. So this flowchart goes on if the hypertension is left untreated, and moreover the person being hypertensive intakes more salt or more sodium rich foods, then this cycle may continue and lead to fatal changes. Next slide, please. So we see that for maintaining the sodium consumption in our daily life, not only salt is the culprit here. Salt is definitely the matter, but there are we must be aware of the foods that contains hidden sodium in them. There are various foods like barley, rice, lentil, Bengal gram dals, rajma, soybean, some fruits like bale fruit, fresh dates, lemon, musambi, fishes like bata, bhola, parshe, ityadi, like etc. Like these fishes and foods contain zero sodium. Like this will not increase your sodium consumption during the hypertensive stages. There are some low sodium content foods also like bajra, jowar, onion, sweet potato, bottle gourd, brinjal, onion stalk, parvar, orange, pears, like ripe papaya. These are all low sodium food. Like this contains sodium but in a very low level. So these are also safe food for preeclampsia as well as normal hypertensive patients. Next slide, please. Here comes the high sodium foods. So many of you people might have encountered such patients, or you may have seen the family members also say that the like papad, we do not fry papad, we bake our papad and have, like as if the oil is the only culprit there, but it is not that. If you are hypertensive, you should not just only avoid the oil. You should have you must have in the knowledge of sodium contents of the food itself. Like the dough prepared to making the papad contains high amount of sodium in that. So that increases the hypertension situation. So if you are hypertensive or you have elevated blood pressure and you are taking medications or might not be on medications, whatever may be the case, you should avoid these foods like snacks like chips, packaged foods, cheese, like extra salted butters, salted crackers, like juices or fruit juices or vegetable juices that contains extra sodium, like fast foods like burger, pizza, etc. Some instant foods like instant soupy noodles, like soups, packaged soups are available in our market. Sausages, soya sauce, or like pureed form like tomato puree also. All of this contains high sodium to actually the sodium, the salt here acts as the preservative, like they preserve the thing from being degraded. So the salt is added for a purpose, but if you take it in unlimited way, or if you're hypertensive and still taking these foods, you might not be taking extra salt, but you are taking salt rich food. So sodium is hidden in this food, so try to avoid. Okay. Okay, next, the dietary modifications of the hypertension will be further described by Mafuza. So handing over to Mafuza. Thank you.
Thank you, Suparna. Good evening, everyone. And thank you, sir, for giving me the chance to participate in a such kind of platform. Hello, audience. I think you all are eagerly waiting for this dietary part. Now I am trying to describing this. Now I am coming to my first point, carbohydrate. It not carbohydrate, energy part. It is the daily calorie requirement which is calculated by a dietitian as per as patient's physiological conditions and biological conditions. Carbohydrate. Carbohydrate should be 45 to 55% of total calories. As we all know that there are two types of carbohydrate, that are simple carbohydrate and complex carbohydrate. So we should emphasize the complex carbohydrate because complex carbohydrate are rich in dietary fiber. So when we give a diet as a dietitian, we have to teach them about the complex carbohydrate. We tell them for choosing the uh, brown rice, atta bread, dalia, whole flour, oats, ragi, bajra, quinoa, which are good source of calcium, iron, and B vitamins. And we also suggest our patients to avoid simple carbohydrate as much as possible. Next slide, please. Now I am coming the protein portion. Protein is recommended 0.8 to 1 gram per kg body weight. So it is about 15 to 20% of total calories, but it may vary in some pathological conditions like kidney disease. But we should aware about the intake of both sources of protein, like plant protein and animal protein, which give us the high biological values of protein. We can take the protein from fish, skinless poultry, soy product, and etc. Next, next slide. Fat should be 20 to 25% of total calories. Here we should take PUFA, MUFA, and saturated fat as per as 1 is to 1 is to 1. This type of portion. Okay. And saturated fat should be less than 7 to 10% of total calories. We should aware about the trans fat. This kind of fat should be totally avoided, like commercial baked food, cake, cookies, chips, etc. Fried food like fried chicken, French fries, pizza, burger, which contain high levels of trans fat as well as sodium. Unfortunately, many people are very much serious about diet, but they cannot aware about the amount of oil. But for maintaining a healthy life, we have to limit the amount of oil. For a person, it should be 10 to 20 ml per body weight for a day. Okay. Use the mixed type of oils and must be used in a rotation way. Like we eat mustard oil, canola oil, soybean oil, but we have to emphasize the rotation way. ওকে, আমরা মাস্টার অয়েল খেতে পারি বা কোকোনাট অয়েল খেতে পারি বা সয়াবিন অয়েল, কিন্তু আমাদেরকে এক এক দিন এক একটা খেয়ে যেতে হবে এবং আমাদেরকে এটাও দেখতে হবে যে অ্যাভেলেবিলিটি আছে কিনা বা ইকোনমিক্যাল হবে কিনা, সবকিছু মিলে আমাদেরকে অয়েলটা কনজিউম করতে হবে। আমাদের আরেকটা বিষয় খেয়াল রাখতে হবে, সেটা হচ্ছে কুকিং প্রসেস অফ দ্য অয়েল। Do not heat oils over time because every oil has a smoking point. Okay, heat leads to generate the trans fat, and sometimes we eat butter and ghee as we যা আমরা চাই যেভাবে ইচ্ছা সেভাবেই খেতে চাই, বাটার এন্ড ঘি মনে করে এটাও হচ্ছে একটা গুড ফ্যাট, but we should consume it in a limited portion. Next slide please. Next slide. Now we are coming to omega-3 fatty acid. This is the good fat of our daily requirement. Omega-3 fatty acid is not produced by our body because it cannot make our body. We have to obtain it from our dietary sources. We can take it from our seafoods like sardines, salmons, tuna, like hilsa, and plant source protein, almond, peanuts, which is very heart healthy food. Next slide. Here are describing how to reduce saturated fat. Please go through it. Next slide. This is a healthy food pyramid. Green portion refers to us that we can take the green and non-starchy vegetables as we can, and yellow portion refers to good fats and protein. Okay, we can take it as per our body's requirement. Next, the orange portion. This part refers our fuel, which give us instant energy, like carbohydrate, fat, fruits, sweet fruits, like sweet fruits. This gives us the instant energy. These kinds of food should be by the body's requirement. And the red portion, which tell us to stop. Okay, so these types of foods are the white foods and the brown foods. White foods refers the white sugar, rice, and white rice and bread. These are very harmful for our bodies. And the brown foods, which I have already described in my fat portion. Next slide, please. Here's this pyramid shows the perceptions and the actual intake. And the previous slide, which refers us that what kind of food we have to follow. But actually, we follow this kind of pyramid. Such like এক্সামে কেউ ভালো করেছে, অথবা বার্থডে পার্টি, অথবা কেউ get a good job, let's give a party and enjoy this kind of food like alcohol, burger, pizza, chocolate. Actually, we celebrate our good days with bad foods. Next slide, please. Here shows the food signal. Okay, like here red refers to which food we have to avoid it. Yellow means in moderation intake, and green means the healthier choice. Next slide. Here are these green foods. This refers mainly the fruits and vegetables, but this kind of foods also be harmful if our cooking process is not right. This means cooking process is very important. So we have to cook them by steam or boil, not too much frying, just bhaji. And use a limited portion of oil. And we must include salad in our daily meal, which is very harmful. This is the yellow part, and here we can see different colors of legumes, different colors of rice, like a brown rice, white rice, different colors of seeds, and many other foods. So, can anyone say which one, uh, the rice portion, which one is good for our health? Hello?
Brown rice.
Brown
Yes,
rice.
yes, brown rice. Can you tell why it is happening? Okay, I say it is healthier because it contains more fiber and nutrient rather than others. So we have to choose the brown portion of the rather than the brown rice rather than the white rice. For seeds, we can suggest our patients like them in between meals, two meals, like the snacks items. We have to use the seeds of this part from this part. Then here is showing the boiled egg, curd, cooked fish. We should take them in a moderate portion. Next slide, please. Now the this portion is referred the red portion. Okay, the red, which means danger, but we all love this kind of food, and these kinds of foods have a great cravings, but we all know that these kinds of foods are high in trans fat and sodium, and trans fat and the sodium, which are the main culprit of the hypertension. So we must avoid it if we want to prevent hypertension. Next slide, please. Now I am telling something about DASH diet. It is a low salt dietary approach to stop hypertension. This diet is proven to help lower blood pressure. This diet is rich in important nutrient and fiber. It also includes food that are higher in potassium, calcium, and magnesium. And mainly, it is lower in sodium. The goal of DASH diet are limit sodium by reducing the intake of salt and sodium-rich food, reduce saturated fat and include MUFA, PUFA, and omega-3 fatty acid. Choose the whole grain cereals, choose the fresh fruits and vegetables, eat nuts, seeds, and legumes. Choose the moderate amount of protein. Next slide, please. Here are showing the serving of DASH diet, which is prescribed by a dietitian. Next slide, please. Now, here is showing the sodium restriction in hypertension. Uh, we uh, observe uh, we observe the patient's physiological conditions and physiological and biological conditions, and we see the patient's lipid profile and any other test. And we have to restrict the sodium by the limiting salt and sodium containing foods. In mild restriction, sodium restriction, cooking salt should be used lightly, but egg, milk, and meat can be used. But in severe restriction, we have we should be totally avoid the salt, and also egg should be restricted. Thank you all for your patience hearing, and I'd like to hand over this management part to Ms.Swati Pandey.
Thank you, Mafuza. Very good evening to all.
First, I would like to thank you, thank Cognize Nutrition for providing me this opportunity to speak in front of so many audience, so many people, and my fellow speakers who have already explained very well about the part of causes and symptoms, complication, and dietary management regarding the hypertension. So you might be wondering why this management part is with me. You are right that this management is actually the lifestyle management, lifestyle management. It is the first step of the hypertension control that we have to make changes in our life. So basically, when we look at any food, food is the life. The food comes in two forms in front of us. First is the wholesome food and second is the packaged food. So what is the major difference? Can you tell me? What is the major difference between these two foods? Can anyone tell me?
The natural food and the
Wholesome food
packed
and
food.
the packaged food. What is the major difference? Okay, let me tell you that wholesome food is naturally obtained from the farm or from the natural products, and they are absent of any label. But in the packaged food, we always find label. Why this label is given? Label is given because all food is perishable, you know very well. But packaged food is made unperishable or to increase their shelf life, to make it more storageable and make it more tastier, we have to make it packet and we have to make it labeled. That's why it is a major difference between the packaged food and wholesome food. So what we do in this modern era, we cannot avoid the packaged food at all. It is a modern technology era. So we have to become dependent on these things somehow or some other way. We have to eat some biscuits or snacks like these things. But what change we can do in the lifestyle is to make the better choices of the food. How we can do? By creating our own awareness regarding the labeling of the food, which is the nutritional facts. Which see in this slide, you can see the nutritional fact label is there. In most, so every label is almost like this in the most of the packaged food. What we do in the starting from the first point, nutritional facts and the serving size, which serving size means मतलब यहाँ पर लिखा है serving size 1 meal, मतलब कि whatever container has this label serving size 1 meal, मतलब कि ये एक बार में खा सकते हो आप. Okay, but look at the calorie. It is 240. मतलब कि एक बार में खाने पे आपको कितना कैलोरी मिलेगा? 240 मिलेगा. See, there are several facts which are given in the nutritional fact, but here majorly we are concerned about the sodium. Can you tell me that what is the journal for a normal average level of the sodium intake in the human body? Means male, female, normally what we should take, how much permittable sodium is allowed? Can anyone say? It's approximately 2300
We just
milligram.
saw in the last slides also
Yeah,
already.
Mafuza has already mentioned this.
Mafuza has already, nobody is paying attention, that means.
Yeah, it means.
Nobody is paying attention for the awareness of hypertension. So you are the people who can create the awareness.
Thank
And
you,
this
sir.
most important part I find, which Ms.Swati is now describing, this is the most important part we have to
Yeah,
look
it's
up.
a basic thing.
We
We
are
must
basically
be.
depend on this commercial
Yeah,
food.
yes, sir. Basically, I mean, it is a simple thing which means most of the audiences are from the nutritional background. They must know that the basic sodium intake should be.
Even Swati, because
Yeah,
in the rural
yes.
areas, the prevalence is less if we
Mm,
consider for India, and
mm,
the urban areas, the prevalence is high. The slide in front of you is the use
yeah,
of bread.
it
It is
is.
not in the rural areas, but the
It
bread
is.
or
Yes, yes,
this
sir.
packed food or packet milk, all these things are used in
Yeah.
this urban. শহরে যেটা ইউজ হয়, গ্রামের দিকে সেই খাবারটা ইউজ হয় না. So this is
Mm.
a very important point, and you should know this is a Viva question. This is a I
Yes,
think
sir.
many times we used to ask that what is the recommendation of salt and what is the recommendation of sodium.
Sodium.
Salt is different than sodium. The recommend Sodium is present inside salt, so the recommendation is Britium. So do not give the answer. We will take the answer in the chat box. What is the
Okay, okay, sir.
recommendation?
Okay,
Sodium
sir. Okay, sir.
per day.
Hmm.
Already described in this.
Yeah,
At
sir.
least that 3 students should answer.
Yes, sir. Yes, sir. So, see, basically, most of the nutritional facts and label look like this, where we can get all the informations. Okay, because sir has not given me permission to mention the correct amount. Let's move to the another side, which is the practical approach, where we can compare the things, compare the two brands of the cracker. Okay. So here I have taken two types of cracker packets, a cracker A and cracker B, and both have the nutritional facts. Can you see that both have the same calories? How much it is?
90 calories.
Yeah. So whatever cracker packet you are having, cracker A or cracker B, both have got the same calorie, both will give you same energy. But which one is has to be chosen? It depends upon your choice. You have to make the better choice. What we will see first, see in hypertension ना हमको तीन चीज का एकदम ख्याल रखना चाहिए. पहला है कि फैट का, दूसरा है सोडियम का, तीसरा है फाइबर का. फैट जो है क्या होना चाहिए, कितना होना चाहिए, यहाँ पे देखो फर्स्ट क्रैकर में लिखा है 13%, isn't it? सेकेंड में लिखा है 2%, तो 13% और 2% है यहाँ पर. ओके, एंड सेकेंड इज सोडियम 280 and 90. Fiber is 1 gram and 3 gram. Remember that the fat, सैचुरेटेड फैट, ट्रांस फैट, अनसैचुरेटेड फैट 1/3 से ज्यादा कैलोरी नहीं आना चाहिए पर सर्विंग में. ओके, तो यहाँ पर क्या दिख रहा है, हमारा फैट किस में ज्यादा है, क्रैकर ए में ज्यादा है. ओके, सोडियम किस में ज्यादा है, क्रैकर ए में ज्यादा है. एंड फाइबर किस में ज्यादा है, क्रैकर बी में ज्यादा है. तो क्या फाइबर ज्यादा है तो इसको इग्नोर करेंगे, नहीं करेंगे. फाइबर इज गुड फॉर अवर हेल्थ. सो ये तीनों फैक्ट ऐसे हैं, तो इट मेक्स which cracker more what I can say approvable? Yeah,
Sir, B.
right, very good, very good. And below this it is given daily values greater than 15% or daily values less than 5%. Remember there is one golden rule. अगर तुमको न्यूट्रिशन कुछ नहीं मालूम है, जैसे कि किसी आपको मेड को समझाना है, तो क्या करोगे, 15%, 5%. रिमेंबर दैट जो भी चीज अगर 15% से नीचे है, मतलब कि वो चीज उस पैकेट के अंदर बहुत कम है, और 5% से नीचे है तो कम है, 15% से ऊपर है तो वो ज्यादा है. बस एक सिंपल लॉजिक में जाते हैं 5/20 के रूल में. तो जो भी चीज 15% से अबव है वो चीज हमको थोड़ा सा अवॉइड करना चाहिए. अब फाइबर अबव है तो नहीं कर सकते हैं, क्योंकि फाइबर इज वेरी गुड, but it depends upon the nutrition also. Okay, let's move to the another side, that why labeling is essential, why we should read the label. Okay, let's move to the another slide, sir. Okay, देखो, what happens when we go for the food purchasing. First thing, हमको सबसे पहले लगता है ओ इसमें तो जीरो शुगर है, let us take this. Low fat, let us take this. High fiber, let us take this. No cholesterol, let us take this. These words seems very, very appealing and very, very interesting for us, and we think that we are making very healthier choices. Multigrain atta, multigrain biscuit. But do you know multigrain है तो क्या हुआ? These are simply marketing tactics. We should be aware of these things. Multigrain मतलब क्या हुआ? All the grains might be refined. So what you are doing? You are not getting the nutrition. You are simply having multigrain. Multigrain मतलब कि refined thing है वो. Okay? बोल रहा है कि zero cholesterol. Zero cholesterol oil. Peanut oil, zero cholesterol. Can you relate anyone? What it is? Cholesterol or
All
zero
oil packet it is written zero cholesterol.
Zero
কেউ কি বলতে
cholesterol.
পারবে যে এটার রিলেশনটা কি?
What
এটা
is the
লেখার
relation?
মানেটা কি? Which oil have cholesterol? Can anyone answer?
Any oil which is obtained from any animal source, because plant sources do not have cholesterol at all. So it is a marketing
Good.
gimmick to write as no cholesterol in any type of plant-based oil.
Yeah. Very good.
It is eyewash. What is your
স্যার
name?
প্ল্যান্ট স্টোরেজ ফাইটোস্টেরল বলে হয়, ফাইটোস্টেরল থাকে.
No,
Yes, it
phytosterol
contains plant
phytosterol is something different from oil. It is not actually the oil thing. It increases,
Yes.
it's like in soybean होता है ना, soya seeds के ऊपर outer layer में phytoestrogen होता है. जो कि एस्ट्रोजन लेवल को इंक्रीज करता है. Okay, so it is not at all related with the oil.
Okay, ma'am.
It is mainly based on the source, plant source or animal.
Yeah, transfer cell. And remember that the cholesterol always stays in the outer cell membrane of the animal. Even our body has cholesterol. कहाँ से आ गया? हम vegetarian हैं, हम कहाँ से आ गया? हमारे अंदर cholesterol. Okay, every cell, every human cell or any animal cell produces cholesterol. So anything fat coming from the animal source has cholesterol, but the plant source doesn't have cholesterol. So peanut butter, no cholesterol, zero cholesterol. अरे कहाँ से आएगा वो? It is all the marketing tactics. You must be very, very smarter in these choices. Sorry. Like similarly, zero sugar. Zero sugar में क्या होता है? Sugar नहीं है, but उसमें क्या है? Fructose sugar डाल दिया है. Corn sugar डाल दिया है, dextrose डाल दिया है, saccharin डाल दिया है, which is not at all advisable for the hypertensive person. And these are simply like marketing tactics. It is nothing to do with the nutritional facts. Similarly, that is, we have to go for the reading of the nutritional information panel, and we should always check the ingredients list. And remember, yeah, it is the fourth point, and see, it's the most important point that जब ingredients list आप देखते हो तो first 3 or first 5 ingredients are the most crucial ingredients of that product. तो उसमें आपको देखना होगा जो आपके लिए beneficial है or not. If it contains sugar, more carbohydrate, remember, जैसे कि health drinks आता है, I will not take the name, which most of the people, अच्छी जल्दी लंबा होने वाला, 3x height बढ़ाने वाला, you just go through the ingredients, पीछे देखोगे, first 3, 4, 5 में ingredients, what are the things, does it contains more sugar, does it contains more gluten, does it contains more carbohydrates, whatever it is, so whether they are beneficial or not. So these are the things we have to keep in the mind while taking food for ourselves, our kids, our family members, our elders, everyone. And see here in the left hand side, it is also written quick guide percentage daily value. 5% is less is low, 20% or more is high. So I hope I'm able to convey the information of the labeling. Is it not? So let's just move to the next slide, because lifestyle management is not only about the food, it's also about the health. Specific yoga and exercises are also recommended for the patients of the hypertension. These are the specific 5 yoga asanas which are quite essential, which are very slow movement exercises which are recommended for the hypertensive persons. Like first one, it is shown that Adho Mukhasana, matlab ki it will produce flexibility to your spine, it will relaxes your mind, it will stretches your body, and is very, very good for the hypertensive person. Second is Paschimottanasana, it relaxes your hamstrings, spinal cord, brain, it reduces anxiety, depression. Yeah. And then the Setu Bandhasana. Riya, please.
Tanya need to mute.
Yeah. And fourth one, it is Balasana, and last one is Savasana. Savasana means, Shav means in Hindi we say it is dead body. I mean, dead body means lying straight with slow breathing. It relaxes your nerves, it relaxes your body, it relaxes your heart pumping rate, and thus it controls our blood pressure. And remember that it takes around 1 to 3 months of the regular exercise to see the effect of the blood pressure. So the key is you have to become you have to take it mild and consistent in your effort for making any change in the yogasana. And one thing I would like to mention that you have to avoid some of the very intensive and short period exercises like sprinting, weightlifting, which generally what it does, it is a brisk workout which makes your heart and lungs pump harder, and it makes your breathing faster. So you have to take care of that also. And before anything, I would like to say that before opting for any workout, you should consult your doctor, physician, as well as it should be performed under the well-trained instructor. Next slide, sir. So it is the thing, it is the whole thing of the exercise effect, what I have told you earlier, that it reduces the heart rate, and it increases our cardiorespiratory fitness, and above all it increases our muscle mass. कौन सा muscle mass? It increases our muscle mass, which is actually the lean muscle mass. Thereby, it increases our strength in our body, reduces the waistline. Yes, I would like to mention that in the male, you have to become very conscious about the waistline. If it is greater than 40 inches, there are 90% chances that you may have the hypertensive in the later part of your life. And if in the female, if it is waist is more than 35 inches, then there are chances that you may have the hypertension in the later part of your life. Thereby, regular exercise, it decreases the fat mass, decreases the weight, and overall it controls our BMI, which is quite essential factor. It is the easiest form of reducing our hypertension is to go for the mild exercise. Next slide, sir. Yeah. So these are it in the nutshell. I have given the tips how to lower the BP. First point is to eat the heart healthy diet, which is already well spoken by by Mafuza, which includes potassium and the fiber. Fiber means क्या होता है? While reading the labeling, you should see that it should always be greater than 3%. Why? 3 gram. Because in the whole day we have to go for the around 25 grams. So अगर 3 grams भी हो रहा है उसके अंदर, तो it means that it is negligible, nothing else. Okay, potassium rich food you have to take, because which is rich in which is mostly found in the fruits and vegetables. But before taking, because it reduces the effect of the increased sodium in your body. But you have to become very conscious while taking the potassium, because in the CKD patient or the renal patient, this has to be controlled. Drinking plenty of water automatically controls our blood pressure. Exercising regularly and quitting smoke, limiting alcohol, salt consumption, it should be less than 1500 milligram of per day. But in the acute hypertensive person, it is recommended 500 mg also. Okay, and stress. In nowadays, the stress is most prevalent thing, which is the causing hypertension. So we have to take care of that also. And that's why after this, I'm just handovering this webinar to some Suparna, which will tell you about the medicines of the hypertension. That's all. Thank you.
So we are running out of time, so we should move little bit fast. Thank you, Swati, for nicely explaining.
Thank you.
Suparna is going to explain very important thing, and then Riya is coming with the myths and facts. Suparna, you are ready? So during Riya's presentation, you need to interact. ওটাই আমাদের last presentation থাকবে. So during this, you have to please interact with Riya. So Suparna, move on. Just quickly sum up with the medication.
Thank you, sir.
And there are dietitian, nutritionist also. Please pay attention, because when you are treating any patient with diet, you need to check the prescription that which medication the doctor has given, which hypertensive drug, which cholesterol drug doctor has given. That this Swati, Suparna, Mafuza, they all are doing it in their everyday life. Okay, Suparna, go on.
Thank you, sir. Thank you, Swati, for explaining the management of hypertension so well. So now comes the part of the medications. The dietary and lifestyle modification, when somehow lacks in controlling hypertension, the role of the medications comes in play. Many of you can already identify the medications enlisted in the examples of the medications here. So, like amlodipine, benazepril, ramipril, these are so very common medications we found in everyday life, like in every prescriptions, in fact in your own home also, like your parents might be taking someone. So there are lots of drugs we see that they are taking, but many of us, we do not know but and many of people, they also do not know that which medication is for what complication. So as a dietitian or as a lifestyle counselor, we must have a knowledge, at least a brief knowledge about the medications also, so that we can tell the people that this is your blood pressure control medication and take it on this time and this after breakfast or whatever it is suggested by the doctor. And we can also suggest them that what food to avoid after with the medications also. So there are various classifications of drugs. Like all the drugs do not affect our body in the same way. They act in different ways in different organs or different parts of our body. First comes the enzyme or chemical blockers, like the angiotensin converting enzyme inhibitor or ACE inhibitors, beta blockers, calcium channel blockers, etc. These medications or these classes of drugs affect basically on blocking the chemicals or blocking the calcium channels or blocking the chemicals or the enzymes that converts the chemicals into active form. Thus, these chemicals cannot work on your blood vessels, and further your blood vessels cannot be constricted. So in this way, these drugs reduces the increase in the blood pressure. Some drugs affects only on the receptors. There are the chemicals, angiotensin converting enzyme is converting angiotensin in active form, but the angiotensin 2 is not activated, is not working properly because the receptor has been blocked. Angiotensin 2 receptor blocker or ARBs. So like telmisartan, olmesartan, these are very common drugs we can find, and these drugs affect on the receptors, and thus the smooth muscles will not contract, the blood vessels will be relaxed, and the blood pressure is maintained. Next slide, please. Next classification comes the vasodilators. Till now, we saw that the drugs are acting on preventing the constriction. But whenever is the blood vessel already constricted, the vasodilators acts on the smooth muscles of the blood vessels and relaxes the muscle so that the passage increases and the blood flows smoothly, and then hypertension is relieved. There are some diuretics. Diuretics comes from diuresis, excess water is excreted through your urine. So these drugs affects in the kidney only, and they help in excreting extra salt like sodium. Some diuretics also excrete sodium along with potassium, and some spare potassium and only excrete the sodium along with water. So in both cases, diuretics excretes the water from our body and reduces the blood volume, reduces the pressure on the vessels, and hypertension is managed. In some cases where only one kind of drug is not working or might be the other complications is implicated, so the doctor might suggest a combination of medications. Maybe one medicine is containing both type of drugs, or maybe two different medications has been given on two different times of the same day. So these medications in combination work in our body in different parts as described before. So then these all medications relieve our blood pressure in different ways. So many of us already knew, and many of you might have been known this thing now. So after knowing the drugs and after knowing their mechanism, are we able to select the medicine or select the dose of the medicine or switch the medicine with other drugs? Are we able? Anyone?
No.
Right. Because we are firstly not allowed to prescribe drugs, and we are nobody to prescribe drugs or take any medication on our own. I repeat, we are not allowed to take any medication on our own until or unless we are prescribed by a certified physician or a doctor. So when you find some problems in your health issues, like maybe the hypertension in this case, you go and check, visit your doctor or physician and tell him what is your complication, what is your current situation, and what were your previous medical history and everything. Knowing after everything, So the doctor prescribes the medicine properly suitable for you only. This is customized thing. The dose is only dependent upon your conditions only, and he will call you on follow up, because the doctor will also want to see that he is giving some dose, and if in the follow up you are getting good results, that means it is okay. If there is any sort of changes needed, he will make the change or follow up. So this is the procedure of taking any drugs. Never ever go for the drugs as you know now that these medicines are these, okay chalo hum ye le sakte hain. No, we cannot do that. Like we got vasodilators, doctor prescribe किए, लेकिन हम लोगों ने देखा कि वो हमको काम नहीं कर रहा, तो हमने डायूरेटिक्स भी उसके साथ चालू कर दिया, फिर स्विच कर लिया अपने से, या फिर दुकान में जाके बोले कि मेडिसिन शॉप में भैया ये मेडिसिन हम खा रहे हैं लेकिन ब्लड प्रेशर कंट्रोल नहीं हो रहा है, तो भैया क्या किए कि लाइक चलो ठीक है तुम ये दूसरा मेडिसिन लेकर के जाओ, ये इफेक्टिव है। ऐसा कभी नहीं करना है। until or unless you see your prescription with a doctor, he will change the medicine, he will combine medicine, he will detect the dose. Okay, so over the counter medication is never ever encouraged, always discouraged. And moreover, all like many people do that, gossiping and as if like antihypertensives are like trophies. I am taking this medication, these doses. Oh, she said, and another person is saying that, oh no, I take this medication, these doses, and this affects more. So you can also try this. No, this is not a cloth that you can try this. It is medication. You should not never ever exchange or share your medicine with other person. Always, if the person is suffering, advise that person as a well-wisher that you go and visit your doctor and ask him to sort out the situation every time you find any person in such stress. So never ever share or switch medication on your own and with others. But what you can see, always go to the doctor and prescribe your medications. And that's all. Now I will hand over the slides to Riya for myths and facts.
Thank you. Thank you, Suparna. Thank you everyone for continuing with your patience. Thank you all my colleagues. They already shared their excellent session about the hypertension. Now I am talk about some myths and facts about the hypertension. So I request all of you to participate with me in this session. Uh, the first one is most of the people thought the roasted salt is better than raw salt. So I want to ask you what you think. Which one is better for our health,
You
roasted
can
salt
ask some
or
particular one, Kaustubh or Tanya. Can you please say which salt you are prescribing to your patient? Yes, please, Shoma. Please explain.
Sir, good evening to all. Sir, in a hypertensive aspect, all salts are same. But if we think about that iodine addition, for that aspect, so we can say that raw salt is more better than fried salt.
Conceptually right. Yes. But regarding hypertension, what will be your explanation, Shoma? Thank you for giving that.
That all salts are same. Sodium content is same in both of them, fried or
Good.
raw salt. So in that aspect, we can say that all salts are same. We should use as less amount as
We
possible
can.
for hypertension.
So, Riya, do you agree with this?
yes, yes, sir.
That
Yes,
is
sir.
the
I am
explanation
agreed with
given.
Soma. Yes, sir. I am agreed with Soma that for a person, 5 gram salt is recommended, and 23 hundred sodium is recommended for a day. So the salt doesn't evaporated from the cooking
The
during the cooking or
sodium
frying.
doesn't change in cooking. Yes.
Sodium doesn't even. So I want to ask my second question that most of the hypertension people totally avoid the egg and especially the yolk portion. So what is your opinion about this? Anyone please? unmute and answer.
Sir, can I answer this?
Yes, Nikon, please. No, Devamita.
One
Who
egg.
wants to answer? Nikon answer first, Nikon, then Devamita. Nikon in respect of sodium and Devamita in respect of cholesterol. হ্যাঁ বলো দি Nikon বলো.
One egg should be recommended.
Why? Just give a small example, because you are a dietitian, you are sitting in the chambers. So তোমার কাছে এসে প্রথমেই বলবে ডিম খাবো না, কেননা আমার তো প্রেশার আছে, কোলেস্ট্রল আছে, আমি ডিম খেতে পারবো না, ডিমের কুসুমটা একেবারে আমি খেতেই পারবো না। So what will be your answer এখন? How you will explain? Devamita, please. We need this explanation. You are dietitian, you are not a patient. Just giving in a single statement. Okay, Devamita is on mute. Riya, give the answer.
So according to the ICMR, the cholesterol it can be taken so 200 mg in a day, but egg contain at least 180.
For a cardio patient and not for a normal
For a
patient.
cardio patient, normal patient 300 mg is recommended, and the sodium egg contain 180 to 186 mg cholesterol and 62 mg sodium. So we can give 3 to 4 egg in a week, because egg is not only the rich in sodium or cholesterol, it is also rich in many kind of micronutrients, vitamins and minerals, and there it is also high biological value protein. That's why we should include the egg in the diet. So my third question is, many of people like to take pickle, chanachur, bhujia, this kind of thing in their snacks or the side dish. Do you think this kind of side dish is
Especially not about
packed food?
Packed,
Not only
food.
chanachur, packed food.
Food.
Yes,
I
sir.
am taking masala oats. So is it healthy?
Masala.
What
It is healthy.
Except Shoma. চানাচুর আমরা জানি খারাপ, নিমকি চানাচুর আমরা অলরেডি জানি অনেক সোডিয়াম তেল, আচার, pickles. The Kaustubh, can you say comment something about the masala oats and not soup?
Sir, basically canned product and ready to eat product are contain high amount of sodium that are bad for cardiovascular disease. So we should avoid those canned food and food like chanachur.
Not chanachur, I am exactly asking about oats and soup.
Sir, may I say?
Yes.
Sir, chanachur has trans fat, so too much, because they are using same oil continuously.
Repeatedly they are using same oil. But I am asking about the soup, because health conscious people, because the question Riya has little bit diverted. Riya, the question is about soup and oats, because the health conscious people,
sir, that has
very health
that
conscious.
contain preservatives.
Preservative, chemical,
That
and
also contain preservatives.
These oats are refined oats. Rather, if you want in masala oats, you prepare it with your homemade masala. You can have, Riya, we can have some that is salty oats at home. That is namkeen oats at home. We can add some vegetables. We can make oats chilla, oats poha, oats paratha with the white rolled oats, not the masala oats. And also for the soup, Kaustubh has already mentioned that is lot of preservative, and preservative in the form of sodium. Sodium and salt.
The sodium content is high.
That's why you can prepare a homemade soup, and which will be very much healthy. And instead of salt, we can add little bit of vinegar, lemon juice. We can get that taste. Or we can give some fried homemade masala, chaat masala, etc., or amchur masala, which will be okay. Thank you, Riya.
সব ধরনের সসেস গুলো তো বাদ করে দেওয়া হয় সোডিয়াম কন্টেন্ট হাই এর জন্য। Yes, obviously, because health conscious people will argue with you, Tanya. As you are a diabetic dietitian, so you can understand the people will argue with you that I am taking healthy options. So another thing is coming. What will be your say? This is myth or fact? A very health conscious people, Ria, you can, if you are free, otherwise I am taking your part. That is, I reach 10,000 steps every day. I have a smartwatch. Ria, please continue.
Sir. So many people thought they are very much fit because they are taking 10,000 steps every day. But do you want to answer this? It is enough for a
Agree.
people. Do you agree this?
As a lifestyle.
No, that workout that
No.
should be like workout on that
Yes.
on that activities your heart should be faster than normal time, and that your sweat become out
Sweating is
Sir,
important.
workout should be full with full concentration, not like যে অফিস যাচ্ছি বা স্কুলে যাচ্ছি, কলেজ যাচ্ছি, হেঁটে যাচ্ছি। That is not done. মানে
Brisk working mainly needed.
brisk
Yes,
walking
most
আর
of the
যেটাই করছে concentration এর সাথে।
হ্যাঁ, মোস্ট অফ দ্য পেশেন্ট এটাই বলে যে আমি তো সারাদিন হেঁটে ঘরে কাজ করছি, আমি তো হেঁটে আমি ওপর থেকে নিচে নামছি, তো দিস ইজ নট ওয়ার্কআউট।
This
Actually,
is
what
not
happened, in case of
একদমই একদমই ঠিক।
household chores, in case of traveling to the workplace, we do that every day, and our body gets used to that, and our body takes that as our normal workout. So that is not wasting, like that is not burning extra calories. That is included in your BMR kind of. Your body adjusted to that.
So this is another myth for the health conscious people. So these
Yes.
all are the done by the health conscious or the Google bugs. যারা খুব গুগল ঘাটাঘাটি করে তারা এই সবগুলো করে আর বলে আমি অনেক হেলদি লাইফ করছি। So these are the message to the society. You can mute yourself. There is a background noise from the other roadside coming. You can mute yourself. So these are the things we need to check on, because these are the very important few message we need to say our patient, because egg contains zeaxanthin, lutein, that is choline, which is important for brain development, good for eye, skin. Everybody can have, because it is like a vitamin mineral capsule. Ria has already mentioned. Why we should see only the cholesterol? So out of our daily recommendation, if we cut down on the other fatty foods, we can easily get one egg. সেটা তো
We need to
ডায়েটিশিয়ানকে
cut
করে।
down on the saturated fats.
Yes, we need to cut down other saturated fat or cholesterol rich food like butter, ghee. Then we can fit one egg, because it is a dietitian's job to fit everything. One old patient came to me and like 80, 86. So he loves mango. I have to fit mango for this diabetic patient. And his son-in-law is requesting me that we don't want to give mango. A piece of mango is harmful for him. No, it is not harmful. You are, if he is taking repeatedly, you should, we are, why we are there? So I find one diet chart given by one doctor in dietitian forum. That is a printout leaflet diet chart. Don't give that kind of diet chart which is printout and which is a menu plan. Diet chart should be always tailor made or customized. Again, the doctors are doing what Suparna has given a strong message to us, that we should not prescribe medicine. So this message should go to the doctor. The doctor should not decide the calorie, or doctor should not give any handout of diet charts. Ria, we move to the next slide. Ria, are you there?
Yes, sir. So many people thought that Himalayan salt, rock salt are very much useful for the hypertensive patient, but we should know that they also contain the sodium in the form of NaCl. They also contain 90 to 93% of sodium. So this is not advised that take the Himalayan and rock salt more than 5 gram in a day. It is as much as needed for a day or recommended. So another thing I want to add in this in this session that most of the people thought they are very much fit enough. They should not do not need to check their BP regularly because they are fit enough. So, but the 90% person are found asymptomatic in hypertension. So we should check up the blood pressure regularly and in regular way because blood pressure have no symptoms like other disease. It is a totally asymptomatic. Many people also thought that they are most of the people who are angry or hyperactive, they have the hypertension. But this is also means that hyperactive or aggressive person only have the hypertension. Hypertension has no symptom. Any hyperactivity or aggression doesn't show the hypertensive symptoms. So no one can say that the only aggressive and angry patient have hypertension. Anyone can hypertension in anywhere, any time. Thank you all of you for your kind attention. Thank you.
So we are not describing the measurement of BP, but I will show to you practically sometimes. So these are the few steps to measure the blood pressure. So if you buy one stethoscope, that is single tube stethoscope, and with a cuff, this BP machine, no need to buy a sphygmomanometer which contain mercury. That is more perfect, but you can have this one, and you can easily, this is the brachial artery, you need to point out the brachial artery, and then
একটা
we
কথা
can,
বলতে চাইছি, আমি যখন প্যারামেডিক্যালে পড়তাম তো আমাদেরকে এটা শিখিয়েছিল, তো আমি এটা জানি যে প্রেসার কি করে মাপতে হয়, মেশিন এগুলো আমার কাছে সব কেনাই আছে।
ভেরি গুড। সো এভরিবডি, আমি তোমার জন্য বলছি না,
আমার কাছেও আছে,
সবার কাছে থাকলে হবে না, রেগুলারলি বাড়ির লোকের
আমি
প্রেসার চেক
রেগুলারলি
করতে
চেক
হবে,
আপ করি কারণ আমার মা
নিজের
হাইপারটেনশন
প্রেসারটা চেক করবে
পেশেন্ট
এবং
আছে।
মা বা আরেকজনকে শিখিয়ে দেবে যে সে
হ্যাঁ
যেন
হ্যাঁ
তোমার প্রেসারটাও চেক করে দেয়। দো আমি
হ্যাঁ,
একটা
আমি
ভুল
আমার
করবো,
বোনকে
মাঝে মাঝে আমি
শিখিয়েছি,
নিজের
সে
প্রেসার চেক,
বাকিদের গুলো চেক করতে পারে আমি যখন
বাকিদের
ঘরে
গুলো
থাকি
পারে
না,
তো।
ডিউটি পারপাসে যাই।
This is a very good thing we learned from Priyanka. Your name is Priyanka, right?
Yes sir.
Yes, thank you Priyanka for interacting with us. So this is a very important thing what discussed by Fatma, that if we can keep a glucometer, we can keep a blood pressure, but rather I would advise do not keep the automatic one, you keep the manual one. Just try to learn, this is just nothing, you can easily do this, huh? So I am not just discussing this. So thank you all for joining today's session. It was really excellent that everybody has interacted. We are open for now question and answer
if you have questions.
That there is a
Yes.